Welcome to On the Issues with Michelle Goodwin at Ms. Magazine. As you know, we're a show that reports, rebels, and we tell it just like it is. In this very special episode, we're in Washington, D.C. at Georgetown University Law Center in front of a live studio audience as we tackle an urgent issue of these times. That's war and conflict, and providing healthcare access, preserving healthcare institutions during times of war and conflict. It's a matter that has consumed college campuses across the United States. It's an issue that is ringing in Congress right now. It's a matter that's being taken up by international tribunals. It's a matter that we're tackling in this podcast episode. Before we go further, I want to issue a trigger warning because amongst my panelists are individuals who've experienced torture while trying to provide health care in places where there has been war and conflict. Joining me for this important conversation is a collaboration between Ms. Magazine, the O'Neill Institute for National and Global Health Law, and Physicians for Human Rights. From Physicians of Human Rights, we are joined by the Executive Director, Sam Zia Zarifi, as well by Dr. Houssam al-Nahhas, who is a researcher and a physician at Physicians for Human Rights. Karen Joy Greenberg, who's joined us before in prior episodes, she's the director for the Center on National Security and Fordham Law, providing a very rich perspective about these times. Dr. Seema Samar is the chairperson of the Commission for the Prevention of Torture, a person who's been on the ground in Afghanistan providing essential health care for women and girls in times of conflict. Rounding out this panel is Professor Lawrence Gostin, otherwise known as Larry Gostin, who's the founding director of the O'Neill Institute for National and Global Health Law. Join us in this conversation. Sit back, take a listen. Let us know what you think.
As we come together on this morning on a matter of attacks on healthcare, a global crisis, what could be more important than centering humanity? That, in fact, is what brings us together, thinking about what connects us all. It's my pleasure to be here and to join you. And we're here gathered today to unpack what's happening around the world. There are deep sensitivities about the matters that we will touch upon and that we'll think about. And we couldn't be joined by a more impressive group of individuals than those that are here with me today. As we start off this program, I'm going to ask each panelist to very briefly, just introduce themselves.
Thank you very much, Michelle. I'm Larry Gostin. I'm got a real honor and joy to co-direct the O'Neill Institute with Michelle, and I'm a faculty here at the Law Center and the director of the World Health Organization, a collaborating center on national and global health.
Hello, everyone. Thank you very much for having me here today. My name is Houssam al-Nahhas. I'm the Middle East and North Africa researcher at Physicians for Human Rights. I lead the organization's work on documenting attacks on healthcare, more focusing on Syria as a Syrian physician. And I'm glad to be part of this panel.
Good afternoon, everyone. I'm Seema Samar, and I'm also a doctor. Used to be a medical doctor, but I'm calling myself more an activist or human rights defenders. Currently, I'm a visiting scholar with Fletcher School at Tufts University. Thank you for having me here.
Hi, good afternoon. I'm Karen Greenberg. I'm the director of the Center on National Security at Fordham Law School. And the center's mission is to look at the intersection between national and global security and the rule of law.
Thanks very much. I'm Sam Zarifi. I'm the executive director of Physicians for Human Rights. I'm really here because I've spent a lot of my time working with other people on this panel. I'm really happy to be here with Houssam, with Larry, with whom I've worked on issues around public health globally, and Dr. Sima Samar, going back 25 years in Afghanistan and other places where there's insecurity and inhumanity.
Thank you all so very much for being here. We couldn't be more fortunate, truly. I want to begin this conversation with a question to you, Larry. Very recently, we wrote a piece in JAMA. We were also on a podcast together. And in that podcast, in thinking about the myriad crises happening all around the world, including the ones that don't get much attention, it's a very heartfelt conversation. And we talked about Gaza, but you also shared that personally, these matters touch your heart because your family members were survivors of the Holocaust. So some might say that perhaps puts you in a very unique position to think about what is actually happening in Gaza. So I'll start off with that, Larry. Given the personal and the professional, what situates your thinking?
Thank you, Michelle. I mean, the first, thing that comes to my mind from your question and our conversation is just how painful it is, to see, children, dying, hospitals not functioning. It's just as enormous pain and suffering. And when Michelle and I wrote this JAMA article, and when we've been thinking about it, all of these things are, they're full of, politics and really a lot of hatred. But one thing everyone should be able to agree on is the sanctity of health. I mean, no matter where you're from in the world, your mother will always tell you about your health, about everything. And health is, it starts, of course, with, having, nutritious food, clean water, housing, a sense of security and stability, which we're just not seeing in Gaza and around the world. And then it's the safety net. It's the kind of, if you go to a hospital or a healthcare facility or in an ambulance, or you're, a healthcare worker, either, domestically or from abroad, you're a kind of a special sacred person and in a sacred place. And the fact that you would feel unsafe in those areas and is, I think, should shock everyone's conscience. It just should, irrespective of where you are. A lot of my friends say, oh, well, there's, this side did this side did that. And my answer is, we're not blind. We can see. We see what's happening. That can't be denied. And so I start this whole conversation that we're going to have just from the point of view of humanity, of people, of, not just in a pejorative or ideological sense of the right to health, but a deep, meaningful way that people have a right to feel safe, secure, healthy. When they're sick or they're injured, they have the right to be taken care of. There really is nothing more to say. International humanitarian law does try to respect those things. It's not perfect.
No, not at all.
It is part of the rule of law. But beyond IHL is just the ethical value of humanity and health.
Well, let's pick up on that. And I'm holding the book by Dr. Sima Samar, Outspoken. I think that there's a real purpose behind that title. And in your opening just then, Larry, you mentioned mothers, what a mother would say. And the backdrop of what people are paying attention to, Ukraine, Gaza, but we know that far beyond those spaces in the world, there's conflict, there's crisis, and often rendered invisible happen to be women. On October 7th, what brought attention to the world was the kidnapping, rapes, torture of individuals who were in Israel. There are individuals who were kidnapped who still have not been returned. And the aftermath has been something that has really placed a chill in many ways on conversations about healthcare, attacks on healthcare, and we're unpacking that. But one aspect of that happens to be how women fit into these conversations. And so, Dr. Samar, Seema, if you allow me, I'd like to next go to you because so much of your work has been centered on women and bringing attention to the plight of women in Afghanistan and other parts of the world. And if you could then level set with us just a bit about how these conversations really need to center women, how they deserve to be at the forefront, and what it means when women are not part of the centering.
Thank you very much for asking this question. As a medical doctor and as a woman from Afghanistan, we have been at war for 45 years, and we had almost fought war with all the superpowers. I don't see any country who was not involved. It's only the underdeveloped countries in Africa, some of them, although some people from Sudan and other African countries were involved in the war in Afghanistan. But always in this 45, 46 years of war, women were not there actually. One, because when the Russian invaded Afghanistan in 1979, the men who were carrying the gun were important. Nobody was talking about women. And the sad part was that they choose Islam as a weapon of war and try to support the most conservative group of people in order to stop the advancement of USSR and communism. So women were not there.
Women were there, but not there.
Women were there, but not part of the agenda. Just to give you an example, that I was practicing medicine and I saw and watched that woman is dying because of incomplete abortion, which is 2 minutes or 3 minutes maneuver, and her life can be saved, or dying because of retention of placenta, let alone all those other complicated things. And they were nothing for them. So I started as a medical doctor over there. And then it was strange because when I was going to different UN agencies or any other donors talking about women's and women's rights and women's access to health, nobody was really
People
interested.
weren't paying attention, even as you were saying this, as women were dying.
Yes. And I went to the UNDP. This is after the Russian withdrawal from Afghanistan in 1989, after 10 years of killing and bombing and the disappearing a lot of people, arbitrary killing. They actually bombed villages, water points, livestock of the people. And I was saying that, okay, now the Russian is gone, so I'm glad that UNDP is here. Finally, that UNDP starting some development program in Afghanistan. He looked at me, he said, I said, do you have some program for women? He looked at me, women in Afghanistan? I said, yes. Do you think all these heroes who kicked out the Russian from Afghanistan, they are dropped from the sky? They are born of their mothers. No, I was in Afghanistan for a week. I haven't seen any woman.
I mean, that is the epitome of rendering women invisible.
Exactly. Even today. So anyway, we had this kind of approach to women. Women were not in the center of any decision making. In the last 20 years, when we had after 9/11, the international community with NATO forces in Afghanistan, it gives some possibility for access to education and access to healthcare. And I keep saying that, as Larry said, access to education and access to healthcare, it's not only the basic rights, but I think it's a tool to give you the sense of security and the sense of living life with dignity. So that was there was some development, I would say, because we had the possibility for girls to go to get education.
It was tremendous, the work that you did, the impact. For those of you who don't know it, her work in Afghanistan was absolutely foundational, transformational in every kind of way. I want to come back to this because Afghanistan just seems to be a lingering question. What was old, sadly, has become new again. But before I get to that, Sam, I want to ask you about international human rights because the questions have come up as we've seen destruction and decimation of health institutions that are very difficult to rebuild. And as Larry and I have written about, these have intergenerational effects. When a clinic or a hospital is decimated, intergenerationally, it means significant harms. And people often don't think about when that destruction happens that there were babies at that time in the NICU, that there were people who needed dialysis and that day couldn't get it, that there were people in the middle of treatments and could not get those treatments. And at the same time, what's been raised, and is also important, the way in which these institutions can be exploited by others because they know that health institutions are so sacred. So there are times in which people may weaponize health institutions. What is the human rights law response? What is the international law response to that for people who wonder, are there protocols? Is it unethical? Is it a violation of human rights? Is it a violation of international law to decimate health institutions, even when one is looking for the people who've caused tremendous harm?
Thanks, Michelle. Just to go back to draw the line from where Larry started and where Seema was describing, the notion that healthcare providers and healthcare facilities shouldn't be attacked is actually pretty new. It's really after the Civil War in the US and the charnel houses of Europe in the mid to late 19th century, just when the destructiveness of modern weapons really became known. And people just started saying, this is awful. Like someone has to be able to provide healthcare. And so it really was.
Which would seem to make sense, right? Somebody needs to be able.
Somebody needs to be helped. And this is something where, crucially, even the military men said, yeah, actually, we need to do something. We just can't be shooting, medical workers. So
it's in their self-interest.
It's in their self-interest. But I want to highlight this as an incredible achievement of humanity, that the development of humanitarian law and then human rights law over the last 150 years, this ground up effort to obstruct, to slow the use of violence by states and by powerful people, imposed basically because of realism. One possibility is that a growth in humanity, and another is the fear of the inhumanity that was possible. So humanitarian law came up, the idea of protecting first military healthcare facilities, then civilian healthcare facilities. Then the brutality of World War II happened. And after that, we said, okay, we need more than just humanitarian law. We need actual human rights law. And in that first few years after the Second World War, we had the codification of the laws of war and the Geneva Conventions, but also the Universal Declaration of Human Rights.
And also bioethics.
And just the recognition that humanity had to do something to control the violence.
Okay, let's just take, I want to put a thumb on that because you've mentioned these moments in our history that have been absolutely transformative. The first was to mention the Civil War. Sometimes we speed past matters that we should pause on. It's so easy to do. And to think about a civil war, what does that look like? And here it was the greatest devastation in terms of lives ever in the history of these lands. And that was because there was tremendous devastation that was taking place and exploitations on these lands that would cause people to come from parts of the East and North to battle in the South over this issue of slavery in the United States. And then you mentioned World War II. And there's so much that could be said about slavery because we speed past that too. What was that system of incredible subordination, exploitation, physically, sexually, etc.? And then World War II, that's the Holocaust. And it seems to me that there are also certain ironies that are embedded in both of those moments that you're talking about. Because even as we think about the Nuremberg trials being led by Justice Jackson from the United States Supreme Court, one irony that we skip over in our own US history is this period of eugenics. We're coercively sterilizing and limiting the reproductive futures of people who were considered outcasts. What's interesting about that is that the very platform that justified it, our Supreme Court in 1927, the Buck v. Bell decision, case that involved a poor white girl, Carrie Buck from Virginia, who had been raped, had a child out of wedlock, and it was our United States Supreme Court that said, better than to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. 3 generations of imbeciles are enough. And the irony, of course, was that then the Nazis came to the United States in the Third Reich and picked up exactly that platform, almost verbatim the law that the US Supreme Court upheld, and then began that practice in Germany. And at the doctor's trial in Nuremberg, the defense that was made was, why are you here? We're only doing part where we've only done what you did. How do we rest with that, Sam? What do we learn from that? And I know that's a tough question, and really that's for us all.
Well, I'm in a positive mood. So,
okay.
We'll talk about the inhumanity and the negatives too, but on a positive note. Again, the notion that slavery is improper, the notion that discrimination is improper, the notion that all people have rights, women, minorities, is very new. And so we really forget that. So we have the Universal Declaration right after World War II, the Geneva Convention.
It's not even 100 years old.
Not even 100 years. I mean, the notion that aggression, that invading a country is illegal is less than 100 years old.
It is stunning, isn't it?
So this is an astonishing human achievement. And so we had these norms. They mostly affected states. We then moved to individual liability. After Rwanda, after Yugoslavia, then we had the International Criminal Court set up. It's only 25 years old. And so we've moved so quickly from zero, from untrammeled power of the powerful, from no restrictions, to a place where I would say right now, looking back 100 years, the arc of history has bent toward justice. Now, I would say that probably in the last 10, 15 years, we've seen a deflection or a plateauing, and there's something to. But it is important to really understand what an achievement that is. And just to say, what is a little bit frustrating to me as a human rights lawyer is that we've moved right past all of that. And now people are like, well, why aren't these people in The Hague? What is the good of the UN? Why aren't these people being arrested? I mean, we've gone from zero to people now being disappointed that there is no international force that can stop the bad people.
So what you've drawn out is this tension. And I appreciate the positivity and the hope, because I think at the end of the day, and certainly when we conclude, we want to be thinking about hope because that is so critically important. But you've also acknowledged, and certainly Seema, you have, a sort of question of invisibility, what people endure, right? To get to that space of hope has often meant so much devastation and the silencing of so many, and that kind of pain, right? On the other side of the pain is hope, but it also takes recognition that people exist who deserve recognition. And so I want to engage you, Karen, and build on this question about the role and place of those who are invisible and women in these agendas, because you've built your career around this. You've done such incredible work. I've been so happy when we've been able to be together on panels and podcasts and so forth. I'm wondering how you see and have been responding to these moments that we're in, because your work is longstanding. It's not been just of the now. It's been for a long time you've been working in this space.
Yeah. So first of all, thank you for hosting this event. I think it's really important and very helpful to helping us all think together about this. I want to just say something at the very beginning, which is that I started my career as a student of the Holocaust and decided at a certain point when I had my children that I didn't want a lot of Nazi paraphernalia around my house for my studies, and so wasn't going to do that. And so studied the presidency, got my PhD in American history. The point was I wasn't going down that road. And now, where am I? After 9/11, everything changed in my world, and all of a sudden I founded, don't ask me why, this center on basically looking at one atrocity after another. And so the takeaway of that is you can't escape it. This kind of inhumanity, just, you can decide you're not going to do it, but you know what? We're not in control of it. So I think that's the first thing I want to say. The second thing I want to say, and I want to address this hope issue, because I find it really hard these days to have any hope. I literally, I'm a person who edits a news service every morning and has for 20 years on national security. And it's just, I can't believe I make people read that. And so I'm so happy to hear that there's this, glimmer of hope, but it's getting harder and harder. And so that's what I want to say. And I'm trying to think about why. And one of the reasons is that we are going backwards in a lot of ways. And I don't just mean in terms of how our Supreme Court is behaving and taking away rights. But I think that we're going backward in other ways, which is, you ask about international law, human rights, humanitarian concerns. If you look at how narrowly this is now applied, the amount of exceptions and exemptions that are allowed for humanitarian assistance. For example, when you're talking about sanctions and, the imposition of sanctions everywhere. And then you see that what sanctions do, sanctions is another form of warfare. So when you first invited me to talk here, you said this was going to be about conflict zones. And now it's not about conflict zones, it's about a global crisis, which includes conflict zones. My point is that everywhere in some ways is now a conflict zone when it comes to health.
Including domestically.
Absolutely domestically. And I had started to compile a paragraph or a page on a number of challenges to healthcare right now. But it's not just in this country, it's around the world, right? And whether it's by cyber attacks or by physical attacks or whatever it is, whether it's about the lack of access to healthcare, whatever it is, it's diminishing everywhere. And so I guess what I'm trying to say is that I find that the hope should be, let's get to the other side. The moment for now is, what do we do now? And I just wanted to kind of point to one thing I think we can do, which is that let's start with the battle space. We, whoever we are, humans, have conflated things that are opposites. For example, we have conflated war zones with non-war zones. That's what's going on in hospitals around the world. Oh, it's part of the war zone. We can attack it, that hospital. We have conflated civilians and combatants. You know, we once had a policy in this country of signature strikes. If you were in that place, you got attacked. Didn't matter who you were, right? We continue, as we see now in Gaza and elsewhere, to refuse to distinguish between civilians and combatants. So we don't distinguish between war and non-war. We don't distinguish between civilians and combatants. We don't distinguish in so many ways things that we need to be distinguishing between, including humanitarian assistance versus, well, that one doesn't really pass for, you can't really provide. So I don't know if that answers your question.
Well, we certainly are unpacking the tension between hope and also pain. And so Houssam, thank you so much for being here. Thank you so much for the incredible work that you do. Both you and Seema have been on front lines as physicians. I think that's really important to pause on, especially as we've seen just how people who are medical providers, which would also include nurses and it also includes people who give aid. There's so much to say in terms of the ecosystem, and we want to recognize that, a broader ecosystem of healthcare providers, right? And they've put their lives at risk. Both of you have put your lives at risk. I wonder how you are seeing this moment now in the world where reports are of doctors dying, medical providers dying while rendering healthcare.
Thank you very much for this question, actually. That brought me back to when I decided to study medicine back in 2006. My main intention was to save lives. And this is what I tried to focus on throughout my study. And then when the Syria uprising started in 2011, I was still a medical student. And I made that decision that I should step in, even with my limited capacity, to save lives. And I just could not imagine how providing healthcare can be a crime until I experienced it firsthand. This is when 3 of my team members, we were working under fake names with unregistered phone numbers and clandestine, in a clandestine team, and like treating people in shops, in farms and pharmacies. And 3 of my team members were detained for providing healthcare, were tortured to death, and then their burnt bodies were sent back to us and their families. And that was a clear message back then, that this is what will happen to those who provide healthcare. And that continued. And I continued to think about how this can be a crime until I got myself into detention. And I was, throughout my torture, throughout my interrogation, the only question I was asked was, who were you treating? How were you getting your medical supply? And these were types of questions that shocked me. Because for 5 years, I was just being told that actually saving lives is our first mission. And all of a sudden, I became an enemy to the state. Not only this, but more dangerous. And here I'm quoting the person who was interrogating me. More dangerous than those who are handling weapons and fighting against the country and against the government. And the reason was, we are trying to kill those people. We are trying to kill those who are demonstrating against the government. You are saving them. And this is a crime. And this is what brought me from different,
How in the world did you process that?
I couldn't. And that's why I'm here. My first ambition was to be a cardiac surgeon. This is when I got into medical school. This is what I was planning for. Now I find myself away completely from the medical field, focusing more on documenting attacks on healthcare. Because when I went out of the prison and they forced me to sign the pledge that I will not provide healthcare to anyone who is against the government, the first moment after seeing the sun, after 16 days, that this is what I'm going to do. And I need to bring the attention of the world toward what's happened to me as a healthcare provider and what's happening to all healthcare providers around the world who are focusing solely on saving lives as the most important and the most meaningful work to be done.
Seema, did you ever find yourself in a situation similar or where you felt your life was at risk?
Yes, I think I was a student when the Russian invaded Afghanistan, and then when I became a medical doctor, I was still resisting, but not really taking gun. I mean, I was helping the people who were against the government, and also distributing some pamphlet and night letters to give awareness to the people that why the Russian invasion in Afghanistan is a serious issue. Then I was endangered. That's why I flee Kabul, and I went to the area where it was not under control of the government. So I spent with people over there when I saw the terrible, terrible situation that women were going through because of that. Then I was forced to leave even that area because the Mujahideen become more politicized. They were not anymore the simple freedom fighter to fight against the USSR. They were politicized and bought by different countries, including by the US. And then I was in Pakistan, working in the company.
From place to place to place.
Exactly. Then I was providing healthcare, and I started a hospital for women and children, and also training midwives and female nurses. And I was under attack by the political parties, the Mujahideen political parties, Islamic political parties, because I was providing healthcare to women.
I think that that's something that most people perhaps don't know, exactly the stories that both of you have just told, how providing healthcare itself can be perceived as a crime, how that can lead to punishment, both in terms of criminal punishment and even torture, and also on the civil side, that you must promise to never practice again or practice with people who may not like torture. Larry, I want to come back to you because it seems that even as clear as our panelists may be and the cause of preserving healthcare and health institutions may be, in this time, there are people who still respond negatively to that. And I'll just share with our audience again with the piece that we've recently written that was published in the Journal of the American Medical Association.
Yeah, I mean, and I didn't even send you some of the really nasty comments.
Kept them
back. that we got. I think it's been really very moving and appropriate that we actually focus on physicians and their work. And it is just shocks the conscience. The idea that they're trying to be subjected to torture. But I'll pick up on some of the things that Sam mentioned. As I understand, and you know this much better, both know much better than I do, that international law, international humanitarian law, it's designed to say that even in conflict, even in war, that there are certain rules. There are certain things we should not cross, certain things we should not do. And as I said before, we all know it's far from imperfect. The compliance is miserable. As you said, it's riddled with exceptions. But there are rules. And to me, the singular rule, at least for the what we're here for, is to protect civilians and health infrastructure, but also the human beings that are providing care. Do you remember during COVID-19 when we started applauding the healthcare workers doctors, they were the ones that were going into harm's way.
They were considered essential.
Yeah, they were the essential workers. We sang to them in Italy. We clapped them in New York. And yet we treat them so shabbily. And it's not just in conflict. I mean, even, post-COVID, we started to, attack public health officials that are trying to help us. In our article, Michelle, we suggest a number of concrete ways to try to get greater adherence to this one sacred norm, which is the norm of, the brave nurse, the brave doctor, the brave ambulance worker, the child or the mother that's giving birth in a hospital to protect. Why can't we?
Well, let's pick that up with Sam. Sam, you've been our beacon of hope, and I think that actually is really important. While at the same time, Karen, I completely understand the point that you're coming from. So, Sam, what have been the impediments?
I'm not comfortable with being the beacon of hope, but
okay.
Let me tell you what was hopeful. Let me tell you why I think there was an impediment, and then potentially what we can do. Those norms did hold. They're new. They did hold. Violation, and even today, one of the most hopeful things to me is that both Hamas and the IDF vociferously say that they are abiding by the norms. They deny that they violated the norms. The Russians deny that they're violating. So the norms have some normative value. Now, there is backsliding. And some of the backsliding started with 9/11, where the US just kind of let Karen tell us all about that. But it cleared, not to get too abstract, I'm just a small country lawyer. The stuff that I saw in my own direct work had to do with accountability. And I can take this particular moment back to 2009 and Sri Lanka, where the Sri Lankan government was fighting the Tamil Tigers in a brutal war. And it pushed the Tigers, along with about 50,000 people, into a smaller and smaller corridor. And the Sri Lankan government said, to hell with the rules of war, we're going to defeat these guys. And they did. And the Tigers had no friends. And so people just said, eh. And that moment of lack of accountability was watched very closely by the Pakistanis, by the Russians, by the Israelis. And they all said, look at that. You can actually defeat what is called a terrorist organization. None of this stuff about, you can't do it. You can't defeat terrorism with force. You can, if you don't care about the norms. Then Syria happened. And Assad, and then with Russian assistance, they all said, you know what? We are going to use the Sri Lanka model. If you don't care about the rules and you just kill everyone, and in particular, the strategic value of attacking healthcare. The original norm, it's the original norm because once you start attacking healthcare, then all the people who've been killed or injured are gone. So then Ukraine happened. And so we had the Russians who were now saying,
and Ukraine's still happening.
Right. Now, in terms of documenting healthcare, attacks on healthcare, we've seen increasing attacks. 2019, 20, 22, till this year. Before October 7th, this year was already the worst in terms of attacks on healthcare. I think we had documented around 1,600 attacks global on healthcare. That's record.
They've been escalating.
So, but after October 7th, what is really alarming about it is that the exceptions suddenly started swallowing the rule. Militarization of healthcare is against the law. It's a war crime. A militarized healthcare facility can be attacked. The norm is gone. It's militarized. But this used to be such an exceptional thing. The US attacked one hospital in Iraq that had ISIS in it. And my God, the lawyers ripped their hair out. Oh my God, we're going to attack this one hospital, even though ISIS is firing from it. What's happened in the last few months, and unfortunately supported by the US, is the notion that, you know what? we think that this is militarized and therefore we're going to attack this hospital. And that's the scary moment that we find ourselves in, is that the exception, what was supposed to be exceptional, what was supposed to be done with great reluctance, has now become, well, we think all of these hospitals are militarized. Now, the way forward, it's not just international humanitarian law. And one of the things that Larry has worked on and is absolutely clear is that we also now know that international human rights still apply, even during a conflict.
How do we get to the space of enforcement where it's not just having the norm, but we actually have real respect for law, humanitarian law, international law, and we enforce?
That's a hard one. However,
all of these questions, I think, are hard.
Okay, so there's a couple of things. One of the things about the erosion of norms has been the erosion of accountability. This is not something new that all of a sudden it's just too complicated, too disruptive of things that we care about, like our military force, our intelligence force, et cetera, to go down the path of accountability. That's what we saw in the war on terror. That's what we're seeing now. There's always that'd be great if we lived in a perfect world, but we don't. And so we have to focus on the military accountability. That's number one. Number two, when the global order of 1945 and thereafter is not the global order of now. And we as humans have not come to grapple with that. The poly crisis that political scientists talk about is real. You can't separate climate from healthcare. You can't separate war from climate, from healthcare. They all pile onto each other in a way that they're inseparable. And so trying to take one piece of it is actually not going to work. There needs to be a new sense of how to deal with this beyond the post-45 framework. We all know it. The international organizations that are supposed to be there for accountability, starting with the UN, know that they can't do other than set out the norms and the principles. Another thing, and this is something as humans we're grappling with that kind of just riffs off of what you were saying, is that we have all these great institutions that we want to protect, we want to nurture, we want to grow and expand. But it's not about the institutions or the laws. It's about the human beings that run these places. And this does get to the accountability. We are relying on each other as humans to do the right thing. And that is it's not just more laws. It's people who want to take care of the world. It's people who want to do this the right way. And so what we need to do, is to nurture the generations that are coming up in the right way. And instead, we're depriving them of healthcare, we're depriving them of food, we're depriving them of water, we're depriving them of a sense of security all around the globe. Sorry, I didn't mean to rain on your hope thing. But it's important. And so what I'm really saying is that we need to be, I know we have crisis right here and now. We need to be really future oriented in a way that we aren't. And the reasons we aren't are totally understandable, but that's what we need to do. We need to grapple with polycrisis. We need to grapple with what we're doing to our children all over the world and step up to the challenge now and not in 10 years.
So Houssam, what's needed?
I think we need to recognize first that actually attacks on healthcare are happening as part of a war tactic. It's not just accidental, unintentional side damage. It's something that's happening systematically, depriving people of one of their important needs, one of their foundational needs, which is the need to health, is a strategy of war to break people's resilience. When I saw this happening in Syria in front of my eyes, and I was targeted personally, when the war in Ukraine started with Russia as the common perpetrators, now we will start seeing attacks on healthcare as part of their war tactic. When attacks on healthcare started in Gaza, this is going to continue. This is how you break the communities.
This is how you break spirit.
This is how, when you know that you won't find someone to heal your child if he's sick, or when you know that if you're pregnant, no one will be able to help you deliver your baby, you will leave. This will break you. And then when healthcare facilities become targets, and this is what we've seen in Syria, you as a part of the affected population, you start feeling afraid of getting into this facility. And we have seen this in Syria. Now, healthcare facilities
are
the places that you don't want to go, even if you need to go. Sam, I'm going to leave the final question to you. I know that you said you didn't necessarily want to carry the torch for hope for this panel, but you did mention that. And I do think that it's incredibly important. So I'm wondering, Sam, with this final question, what do you see as a silver lining in a time in which there is so much devastation, at a time in which we have seen the decimation of the facilities and clinics where healthcare used to be provided, where we've seen the destruction of universities, of schools? Is there cultural symbols, historical symbols, artworks, all of those things that are so fundamental, the places where people could rely on to go and eat, to be able to get water, and all of that, which as Karen has framed for us, leaves one feeling so deeply wounded. How does one figure a sign of hope out of that, or a silver lining?
All of the advances that we've seen came after horrific moments of brutality. And I think it's a really important moment right now to understand. And we're sitting here in Washington, and I think the US still plays a crucial role to be able to say that this norm, protecting healthcare facilities in conflict, is one that deserves to be protected. The US attacked the MSF hospital in Afghanistan in 2015. Terrible lawyerly investigation of it. The US was very much interested in defending this norm when the Russians were attacking Ukraine and Syria. And now it has not. And now is the time in this town to really look at it and say, if we don't protect this norm now, the guardrails are off. And it'll be American troops and it'll be people around the world who will suffer. It's hypocritical, but hypocrisy is the space that we live in. Hypocrisy, the distance between what people promise and what they do, is the space for advancement. And that's what we have to work.
Let me say, in December, I was in Ukraine. I was in Lviv with a group of American lawyers who came together with Ukrainian lawyers and were in diplomatic spaces and healthcare spaces to think about this moment. And I want to lift up something that has become part of a mantra amongst people there. And I think it relates to so much that this panel lifted up. And that is unbroken. This is a sign that you see going into the hospitals. It is a narrative that is said by government officials. And I think it really touches upon that psychological component that's necessary to keep people going, that they will be unbroken.
Guests and listeners, that's it for today's episode of On the Issues with Michelle Goodwin at Ms. Magazine. I want to thank each of you for tuning in for the full story and engaging with us. We hope you'll join us again for our next episode, where you know we'll be reporting, rebelling, and telling it just like it is. For more information about what we discussed today, head to MsMagazine.com and be sure to subscribe. And if you believe, as we do, that women's voices matter, that equality for all persons cannot be delayed, and that rebuilding America and being unbought and unbossed and reclaiming our time are important, then be sure to rate, review, and subscribe to On the Issues with Michelle Goodwin at Ms. Magazine in Apple Podcasts, Spotify, iHeartRadio, Google Podcasts, Stitcher, wherever it is that you receive your podcast. We are ad-free and reader-supported. Help us reach new listeners by bringing this hard-hitting content in which you've come to expect and rely upon by subscribing. Let us know what you think about our show, and please support independent feminist media. Look for us at MsMagazine.com for new content and special episode updates. And if you want to reach us, please do so. Email us at ontheissues@MsMagazine.com. We do read our mail. This has been your host, Michelle Goodwin, reporting, rebelling, and telling it just like it is. On the Issues with Michelle Goodwin is a Ms. Magazine joint production. Michelle Goodwin and Kathy Spiller are our executive producers. Our producers for this episode are Roxy Zoll, Oliver Hogg, and also Allison Whelan. Our social media content producer is Sophia Panagrahi. The creative vision behind our work includes art and design by Brandy Phipps, editing by Natalie Holland, and music by Chris J. Lee.